अविनाश करो. Hello everyone, this is Dr. Piyush Dubey and today I'm going to do इसको सेंटर में लेके आओ cystotomy in a small Shih Tzu female. So she is a 5-year-old female with a body weight of around 5 kg. Center पे करो उसको. And she is presented to us with a history of recurrent hematuria. On examination, इसको एक नंबर कम करो. We found that there is a large calculi lodged inside the urinary bladder, and so we are going to do a surgery. So my approach towards this is central midline incision. I'm giving it more toward the pubic area, so it will be like this. So this is my pubic symphysis, and this is the perineal side, this is the caudal side. I will check my bleeding. जल्दी लगाओ उसको. So I will check my bleeders with the help of electrocautery. So hope you guys can appreciate this white line. So this is a linea alba. And here I am inside the cavity. इसको विटामिन के और वो लगा देना, Promestet. This female has a low platelet count of 37,000. The report are sent for further investigation. So that's why we are encountering bleeding over here. Position of bladder is more in the pelvic canal. So what I will do is I will just grab the bladder wall with the help of right angle forceps, taking all precaution that I am not hitting the ureters. So these are the ureters. This is the urinary bladder. Okay, so now I will give incision in bladder wall. Before that, can I have a 30 PDS? I will give uh, stay suture just to lift the bladder up. That will help me in giving a central incision and taking out the calculi. I'll give a stay suture over here and I'll lock this up. यहाँ पे लगाओ. With the help of artery forceps. Now, what I'll do is I'll lift this up and I'll give my incision on uh, comparatively non-vascular wall of a bladder like this. And I will try to take the stone out. So there's a stone, you guys can see. I'll take this stone out. I will go inside with the help of my little finger to see if there is any stone left behind. Don't find any stone in there. I'll just flush this with the help of normal saline, chota like normal saline, you know. We are encountering this much of bleeding because this dog has a low platelet count of around 37,000, which is of a great concern. So we have sent a report for the investigation of hemophagocytic disease. I will just dilate the bladder wall and wash it through normal saline. अच्छे से सक्शन करो. हो गया पूरा? Okay. Right. I will now suture the wall of bladder with double layer of suturing. So this is my first layer. And now I will do this in a continuous, super continuous pattern. Sure. Sir, if you have any question, you can ask me in between. I can answer them. Okay, so खींच के रखो. There is a tear in the bladder wall, so I'll continue this. Okay. इसको पतला करो. Now I'll continue the second layer. Pardon. Okay, so we have completed the suturing of our bladder wall. Now I'll remove this and I'll do a momental patching So this is a momentum, and I'll just put a suture to tack the momentum. So the momental patching helps to heal the surgical wound fastly, faster and better. So I'll see if there is any other source of bleeding that is actually coming up. So we have a bleeder from muscle that will be checked once we close our cavity. So can I have 20 polyamide, please? So I am placing this gauze inside the cavity just to soak the bleeding because she is bleeding abnormally. Okay, so I'll have to just take care that I should not take a bite of my mopper or the lap sponge. बीपी इसका लो तो नहीं हो रहा? बीपी रीड करना. This. I have intentionally taken a bite of momentum along with muscles just to check the minor bleeder, if any. So low platelet counts can really make your surgery critical, especially when you have to deal with abdominal surgeries. So I'll be locking this up with the Vidian's knot. लिखनो की एम्पलीफायर के अंदर एक एक एमएल बहुत है. I am doing इसको विटामिन के लगा दिया और वो प्रोमोस्टेट. So she is maintaining a good BP. That is a sign that there is no systemic blood loss going on. So this bleeding is due to trauma by needle. And as I told you that this dog has a low platelet count, which actually make this to bleed much. बारीक बारीक बड़ा है. थोड़ा सा okay. Now to bury this knot deep inside, I will come like this. जीरो कर दो उसको, ठीक है. I will give staplers to close the wound. So this is it for the surgery today. I will close this with the help of stapler. So these are the sterile staplers that we have. And okay, so yeah, the procedure is completed. So thanks for watching, and I will try to live stream some more surgeries whenever I receive them. So yeah, please take care of yourselves, and bye.